10 seconds, 5 seconds. Health care is a very important financial service industry. It has been growing through heavy investment from private equity and venture capitalists being attracted into India. Investment is increasing in both the private sector and public sector, and large budgets are being made with a vision of an increase of services in this sector by 25% by the end of 2020 in the country. It is time to find out if there is a sizable penetration of health insurance amongst the various rural and urban populations. It is important to understand the volume of investments in this sector and whether coverage of health insurance is correlated with it. Health care is becoming increasingly expensive, so more people should be covered by health insurance. It is expected that more Indians, both in the rural and urban areas, will take health care insurance policies to encash on medical treatments, which are a provision for providing financial protection. There are several healthcare schemes for poor as well as community-based schemes. What is their penetration level? Are the plans fulfilling the needs of the society? Is there an awareness of these schemes by public? This paper analyzes some of these pertinent questions and looks into the fact whether health insurance is a reality or a mirage in India. India is a hub of healthcare industry. It provides services such as medical treatment and surgeries at low cost in comparison with many countries in the world. Several reports have cited that by 2020, India will have the position amongst the top 3 healthcare markets in the world. In terms of employment, by 2015, it had already achieved the status of being the 5th largest employer, directly and indirectly hiring people in this sector. It has also become a major provider of health services and attracts medical tourism as well as research and development activities from advanced countries of the world due to comparative costs difference of its services. Health insurance is correlated with healthcare industry. Since age keeps on increasing and people are prone to sickness, they should be covered with health insurance to be able to take care of their health. As per the data released by NSSO, over 80% of India's population is not covered under any health insurance scheme. This implies that despite liberalization and other macro-environmental forces related to life expectancy, health care costs and increasing incidence of diseases, India is an under-penetrated market. Since investment in India in the health sector is increasing both in the government sector as well as in the private sector, it is important that health insurance should be popularized for the population of the country so that every person is covered with it. India has a sizable population in semi-urban and urban pockets of India who are not covered by any health insurance scheme, primarily due to their inherent nature of work, which is in unorganized sector. It is important to educate the people in these areas to cover themselves with healthcare plans. This paper finds out whether the plans fulfill the needs of the society. The medical care is becoming costlier day by day and it is becoming out of reach of common person in India. The below poverty line population in India constitutes more than one-third of total population. The public health expenditure is either static or decreasing in India. Approx 80% of health expenditure is out of pocket private expenditure. So, health insurance remains only the viable alternative to cover the medical care costs of vast number of people in India. The main purpose of this preliminary study is to find out what are the main reasons for poor penetration of health insurance in the country despite sustained efforts by the government. It can be evinced that health insurance in India is still in its infancy. It is apparent that for a country where over one-third of the population is below the poverty line, some type of insurance mechanism are urgent. The awareness and facts about the health insurance should be a major part of health education and public social campaigns from time to time. The main research proposition is to identify the roadblocks that impede the penetration of health insurance. The data has been collected from semi-urban pockets of Delhi in this empirical investigation. The study is exploratory in nature as the main purpose is to identify the roadblocks that exist in the capital of the country. The sampling method used is purposive sampling and the total sample size is 102. An interview schedule was used for the study and in-depth interviews were also conducted to probe the real manifestations of this problem. We tested several hypotheses and it has been observed that health insurance has been ignored by the people for several reasons. family income is not a reason for such obstruction. There is a lack of awareness of usefulness of such schemes.